All right, good afternoon, everybody. My name is Dalton Witt. I am a primary clinician at Glenbeigh Hospital in Rock Creek here in the county. It's a fancy pants way of saying I'm a counselor at inpatient rehab at Glenbeigh ACMC. So it's my honor, my privilege to do this with all of you today and to kind of have a discussion on April being Alcohol Awareness Month. I spent most of my life being somebody that nobody would want to listen to. So now here, I'm in my second life as a recovering alcoholic and drug addict myself. I feel really privileged when people do want to hear what I have to say, and I take that as a responsibility, and I don't take it lightly. So, Alcohol Awareness Month in April. This is a 36th year that we're seeing Alcohol Awareness Month in our country. The concept in the beginning was to kind of create awareness on the college campuses. That was the issue in, I want to say, 87 when they started this, that to kind of create awareness with the rite of passage style of drinking that we were seeing. And now it's grown into something much more important here in our country and an awareness that I think we all need to work towards. So a little bit about myself. I bring my mugshot with me so people can see it. I am a person who actively lives in long-term recovery from substance use disorder. We have a lot of fancy ways to say it, but I suffer from alcohol abuse and drug abuse. And so this is my lovely mugshot where I earned 2 felony charges in 2015. And I'm proud to say I'm a drug court alumni here in the county. It's an incredible program where we spent 15, 16 months under supervision of the legal system here in the county, and I received a lot of help to get straightened out. And now I'm privileged enough to work for an elite team like Glenbeigh, a nationally ranked program here in the U.S., and I've really found a home there. So it's important to me to give this message as best I can, as I'm representing a team that's really taking care of me. And I found a home there with the Glenbeigh team. So I kind of put this picture up for everybody who's asking themselves, how full of crap is this guy? So this usually gets me a pass on that question. So that's why we do that one. Glenbeigh, a little bit about Glenbeigh first. Right, for those of us that grew up out here in the county, I grew up in the county, we know what Glenbeigh is, but we really don't know what Glenbeigh is, right? So Glenbeigh is a treatment provider for drug and alcohol abuse, and also a dual diagnosis, so some mental health issues as well. So 42 years we have been active in the county. We're a nationally ranked program, which by what I mean by that is we're currently ranked in the top 4% of over 40,000 hospitals that were surveyed here in the U.S. as far as our patient experience is concerned. So we're really proud of that number. Also, we're in the top 2% of out of those 40,000 plus that were surveyed for hospitals where past patients would recommend others to go there. So we're really proud of those numbers, and Glenbeigh always has a culture of excellence, not only for the patient experience, but for us professionals as well. So we're really proud of what we do out there, and I think it's important that we offer this more to the community itself as well. We're trying to get that out there. So we do a little bit of everything. Evaluation, right? Diagnostic evaluation. So for those of us that maybe aren't sure where we're at, we know this might be an issue in our life. Maybe substance use is just doing more bad than good, and we're not sure where we want to go with that. So always my recommendation is to have a professional evaluate us and to see where we're at with that, right? Substance use disorder is the terminology we're going to use today. This is a mental health disorder. And this is what gets us to be able to use the DSM-5, right, the Diagnostic and Statistical Manual, and we can go through and qualify people to see if we need help, either mild, a medium or severe substance use disorder, and what level of help that person might need. So we do different levels of help as well. Of course, we do inpatient rehab or inpatient treatment, where we would come and stay on the campus. And sometimes if our problem drinking is at a stage, or our problem drug use is at a stage where we need medical help to come off of what we're doing. So we do residential long-term care, but we also have partial hospitalization, which might mean we just got to come in for a medical detoxification from alcohol or drugs, and then maybe we have to go back to work, And then we're coming in late at night for intensive outpatient classes where we're doing therapy 2 or 3 hours a night, but we're still in our normal life. Also, intensive outpatient, which we just discussed. This would be, hey, we're maybe at a mild level. We don't have to come in and actually do inpatient, but we're going to get us qualified for therapy. And so I go to work, I live at home, but then maybe 3 or 4 nights a week, I step away and come to group therapy at the center or one of our multiple outpatient centers that we have in Ohio and Pennsylvania, where we can receive that help and still be in our life. And then family services. This is a big part of what we do as well. A substance use disorder is a family disease, and it affects families. And I know pretty much everyone has been affected by some way or another by substance use disorder. So we want to offer that support and those services to families as well. So this is important to us. We do family educational classes 2 days a week through our main campus, and we'll even have on-site family days for our outpatient services. So where our patients are coming in at night, they're going to work, they're living at home, but they're coming in for treatment. We'll even bring people in and have family sessions for our patients during those times, or our clients. And then lastly, we're a treatment center that still offers 12-step modalities for treatment. And I just found it interesting. I read a Surgeon General's report where treatment centers that utilize 12 steps have higher success rates than those that don't. So we do a hybrid of both clinical experience, what they call evidence-based recovery. This would be like cognitive behavioral psychology, motivational interviewing, but we also still offer 12-step programming as well, which would be AA, NA, CA, HA, right? So a little bit about who I am and what I do at Glenbeigh. So alcohol use disorder, we're going to use a term that's kind of becoming passé. I'm going to say alcoholism. And for all of us that might be watching right now at home, or if you're listening here in the room, take a minute and think of what pops in your head when I use the word alcoholic. Right? So this has become a bit of a derogatory term. Right? If I'm a cancer patient survivor, I'm not a cancerholic. Right? I'm a person who has survived cancer. Right? So we want to change this stigma of this term. And I like to do a little exercise. Let's take an alcoholic and let's imagine a top-tier executive here in the county. And they're leaving their office. So let's picture them walking across their parking lot. They're dressed right. They have that powerful walk. Right, they're leaving their 6-figure job. They're stepping into their 6-figure car. Imagine her dressed right with her with the right bag, right, and the right clothing, the right identifiers that says that her life is a success. Then this can still be someone who, in a passé term, would have been an alcoholic, but someone that we could say today could suffer from alcohol use disorder. So we want to combat this stigma that this is the brown paper bag, right, trench coat, sleeping on the park bench, homeless, wandering the streets begging for money. So let's get away from the term alcoholic and let's look at alcohol use disorder. And I'm going to go one step further for the case of this discussion today. I'm going to use a term called problem drinking. And I think that term helps resonate a bit more for those of us that just aren't sure where we're at on this scale. And I should note, I'm a recovering alcoholic and drug addict. I'm a recovering a person who suffers from a substance abuse disorder. But I'm here to tell you, I am not anti-alcohol. I am not anti-opiate. I am not anti-marijuana. I am anti-addiction. Right? I'm anti-substance use or abuse. Right, so this is what really affected my life, and part of my life's work now is bringing that message to others. So I'm not a teetotaler. I'm not up here saying we can't, but I want to discuss what this category that I want to stay on today, which is problem drinking. Right, this idea of in diabetes, many years ago, we were just constantly trying to fight against this onset of active diabetes. And about 30 years ago, they came up with a term called pre-diabetic. And we started, as a medical industry, we started looking into getting out ahead of it, right? Being proactive instead of reactive. And I'm hoping that we're going to see the same turn now with alcohol use and substance use disorders, where we're going to get a little proactive. So the word would be pre-addiction. And this is something that we're really starting on in the industry, right? We want to get out ahead of it before it becomes a full-blown substance use disorder, where maybe we are losing our job, suffering from social and personal and professional consequences, right? So again, we'll stay on the word problem drinking. And the best way I could describe it is problem drinking would be a pattern of drinking that results in consequences, right? A pattern of some type of consumption that's resulting in problems. So of course, if we're going to do problem drinking, any alcohol consumption under the age of 21 needs to be considered problem drinking. What we are seeing is actually in 21 and under, we're seeing a little bit of a decrease nationally in alcohol use. Unfortunately, for 21 and over, we're seeing a little bit of an increase. During COVID, during the pandemic, let's say, alcohol sales increased by 35%, a third, and we really haven't seen that number decline post-pandemic. So even though we're seeing a bit of a decrease in younger folks, we are seeing more consumption at the 21 and over age, and we're seeing actually more consequences of alcohol use disorder or problem drinking here in our country in the math. So what would we consider problem drinking? This is a tough one for everybody. For females, we would say 6 drinks per week or more. Anything over 6, we would consider an issue or a problem area. This idea, now of course we could really get into math on what's a drink, right? What a pour size is. Not everyone's the same height or size, but for the general conversation today, we're looking at anything over 6 for females and anything over 12 for males per week, 12 to 13. So essentially, if I'm doing it every day, this is an issue. Right? We're now in an area where we have a repetitive habit or ritual. Also important to talk about before we get too far, binge drinking. So binge drinking really isn't qualified under substance use disorder or alcohol use disorder. You can be a binge drinker and not really fall into the alcoholic category. But again, I would put this under what we're talking about, problem drinking or pre-addiction. Right, so this is something that maybe in our family or our professional lives or for ourselves personally that we need to pay attention to. The most interesting thing I found when studying for this, the most trackable trait of people surveyed who self-reported as a binge drinker was that they earned $75,000 a year or more. So would be considered highly successful. So binge drinking is the crutch of the highly successful. So binge drinking would be 4 or more per 2 to 4 hour period for females and 5 or more for a 2 to 4 hour period for men. Also binge drinking would be considered anything over 5 or more in essentially a one-day setting. So a lot of people, right, might be able to work Monday through Friday, not consume alcohol, but then on the weekends, right, get into that working for the weekend. It's 5 o'clock somewhere type of cultural hypnosis that we really have going on here in our country and jump in on the binge drinking. Fascinating that we could track it by income. Really, really incredible. So this kind of gives us our parameter for what we want to talk about. Let's stay on the problem drinking aspect. Right, pre-addiction. Let's get out ahead of this before it becomes an issue for any one of us. So let's look at the societal damage of alcohol consumption here in the U.S. Right, I know the hot ticket conversation the last 5 or 6 years has been the opioid epidemic. Well, we figure 110 to 120,000 people die directly of overdoses every year in our country from opiates. We're pushing about 150,000 as a direct result from alcohol consumption. So, and this has been this case for decade after decade after decade. So now we're not trying to denigrate or reduce the responsibility we have for the opioid crisis, but it's interesting to look at it that way. There's far more people die annually here in our country from alcohol than from opiates. But it's never going to be the high ticket seller, right? It's not the sexy conversation to have. And it's so interwoven in our society that it's going to be a really difficult conversation to move forward with. So almost 30 million adults are reported to have an alcohol use disorder, which would be a little bit past problem drinking. And unfortunately, Under 10% of that number annually will receive treatment for that. And this is a number that kind of penetrates all math when it comes to substance use disorders here in our country. Usually less than 10% of people will ever get help professionally. Alcohol is the most consumed substance, not only by minors, but by adults in our country, and is the third leading cause of preventable death, which is a wild statistic. And that's not including automobile accidents or cancer, which there are 7 forms of cancer that aren't compounded by alcohol, but are directly caused by consuming alcohol repeatedly. You don't even have to be an alcoholic or have an alcohol use disorder or a problem drinker. If we just repeatedly consume alcohol for enough time, there's 7 forms of cancer that can be started by that. Esophageal, right? Stomach cancer, throat cancers, all kinds of stuff. So this one I really, oopsie, oh, and I just did that, okay. So this one really shocked me. 40% of all convicted murderers and convicted violent crime used alcohol directly or during the crime. So 40% of all violent convicted crime in our country involves alcohol. That's wild. That's a wild number for us. 37% of all sexual assaults and rape are committed by offenders who are under the influence at the time of the crime. And lastly, about 13,000 people are killed on the U.S. roadways every year directly from alcohol-related accidents. So it's a big stressor and a big tax on our society, but again, so socially acceptable that we may not ever take the steps needed that we're taking with like the opioid pandemic, or epidemic, I'm sorry, to relieve this stress that we have on our society. So let's look at personal damage, right? The numbers on society, great, really interesting. We all think it won't happen to us. But if we look at numbers on personal damage, again, about the numbers vary. I've seen 140 to up to 148,000 people die annually directly from alcohol use every year here in the U.S. Unbelievably enough, almost 1 million youths 12 to 17 will suffer from alcohol use disorder here in the U.S. Also, alcohol is responsible for about 2.5 million deaths worldwide annually. Crazy. So, but it's a harmless little thing. So 70% of alcohol-related violent acts occur in the home. So now instead of talking about violent felony crime, in people's homes, 2/3 of all violent acts will include alcohol in the home. 1 out of every 3 suicide deaths have been linked to drinking alcohol. And about 10% of all U.S. children live with a parent who suffers from an alcohol use disorder. So we talked about the sales increase of alcohol up to 35%. And it's important to state, too, that 70% of all substance use disorders have what we would call a co-occurring disorder, which means I might be addicted to alcohol, but also, or I might be addicted to cocaine or opiates or marijuana, but 70% of those folks will also have an alcohol use disorder on top of that. So now we're into this co-occurring issue where, what came first, the chicken or the egg? So on the personal level, we receive a lot of personal damage from alcohol in our lives. But again, alcohol for a long time, or alcohol use disorder, problem drinking, is really one of the last socially acceptable things it's one of the last socially acceptable mental health disorders that we can chastise people for in public. So maybe even 30 years ago, your anxiety or your depression might have been water cooler conversation in the workplace. But we've seen now really the last real mental health disorder that's a little acceptable to speak out openly about or see it as a moral failing and not a mental health disorder would be alcohol use, right? So, or alcohol use disorder, I should say, problem drinking. This is an issue. We want to get rid of that stigma. Right? This is a mental health concern. Once addiction does start, right, now it's a mental and emotional coping mechanism. So for each of us, for those listening online, or for those of us here in the room, once we use something to receive a relief or a benefit, we would probably consider that a problem stage. right? This is no different than food addiction, gambling, sex addiction, porn, right? Social media, our phones, right? Studies show that you'll light your phone up about 400 times a day today. Whatever that escape is, usually puts us in a problem area. So how do we help? This would be the meat and potatoes of the conversation, right? So what do we do if we have a loved one who we are concerned with that might have problem drinking? The first thing we want to do is show compassion. Again, the idea that this is, we want to get rid of the stigma that in some way alcohol use disorder is like a moral failing, right? In some way you're a bad decision maker. You don't love your kids enough, right? We got to get rid of that stigma, because we wouldn't say, you know what, I wish you weren't so anxious, you must not love your kids as much. Right? Nobody would say that about any other mental health disorder, but for some reason with addiction we do. So we want to get rid of that. So to show compassion, right, to come in instead of throwing arrows at someone, right, we can come in and say, hey, I can't imagine how difficult this must be for you. I know it's difficult for me to watch, right? I'm concerned, right? It's important that we always step in with an I statement. Not you are drinking too much. You look like you're having problems. You are causing trouble here in the home. We got to come in with an I statement, right? I'm concerned. I'm concerned about the level of alcohol that you're consuming. Right? I'm concerned with there seems to be some issue with getting just some of our responsibilities done now, right? And I really worry that that's connected to the alcohol, right? So the I statement is the most powerful thing we can do when we're approaching somebody, not only that we love on a social setting, but even in the workplace, right? It's going to be managed a little bit different if it is in the workplace, but still, these are social responsibilities that we're going to have no matter what. So we can't lecture, shame, or threaten. I think the old idea of get your stuff together, right? Act like an adult. These are, we know now today this is a terrible way to approach somebody who has a mental health issue. And we wouldn't do that with depression, anxiety, bipolar, schizophrenia, anything else. But for some reason, when it comes to alcohol use disorder, we're going to say, hey, you should be doing better. Right? To understand problem drinking, this is going to be a big issue. I think a lot of us watch a Hallmark movie and think we understand how to talk to an alcoholic or a drug addict or a person who suffers from a substance use disorder or alcohol use disorder, right? To make an assumption that because I'm not experiencing it, I in some way am an authority figure to talk to you about how you need to handle this. That's ignorant is what it is, right? What I mean by ignorant is lack of knowledge. There's just a lack of knowledge on how to speak to somebody that's suffering from mental health disorder. So to step in without doing our homework first is dangerous, right? And also, we got to time this talk right. Hopefully it's not 3 drinks in, right? That's probably not the best time to do it. So we got to make sure it's the right time, the right place before we kind of enter in again to the I statements. I am concerned, right? I worry that maybe this might be an issue. I think that we could do family. We got to maybe limit our own alcohol consumption, to lead by example, right? To say, hey, I'm willing to do this with you. Right? Let's get healthy together, right? I would love to go and talk to somebody together. Right? All adults should be in some form of therapy. But anyhow, that's a whole other conversation to have on a whole nother lunch and learn session. So this is a tough one, but we learned this early on. For anybody who's done Al-Anon, we have to stop covering their tracks, right? My family loved me very much and kept lowering the floor for me, so I never hit rock bottom. And little did we know, it probably extended me coming to terms with my life skills and getting help for my mental health issue, because they loved me so much that they were willing to kind of bear that burden for me. So we need to, now we can love people, but we need to learn how to leave them where they're at, right? We can't love people to death. This is something we do a lot now, where we tell people, hey, you're beautiful the way you are, we love you to death. And I'm here to tell you, if we really love people, we can say, hey, I can see so much growth and opportunity for us, right? Let's grow together. We got to seek support from others. So if I am the person who's living with this or experiencing it in my life, as someone I love is suffering from the problem drinking or the alcohol use disorder, we need to have support. This can be hard on you too, right? This is a big burden to carry. It's no different from any other illness in the home, right? If we do have a family member that's suffering from cancer, we want to be that care provider all the time. That's a burden, and that's heavy. And this is no different with alcohol use disorder. If we're helping with that burden, we need to talk to somebody. That's a big burden for each of you to carry. And we learn to seek support in Al-Anon. Al-Anon is a 12-step meeting for people who either know, work, or love people who suffer from an alcohol use disorder. Right? So it's literally just the first syllable of Alcoholics Anonymous, Al-Anon. But this is for family, for friends, co-workers, to get support that they need when we have this somebody we love in our life going through this experience. So there's a famous 3 C's of Al-Anon, which is important for all of us to remember. We didn't cause it, we can't control it, and you definitely cannot cure it. So we have to set our egos aside a little bit and realize that to do this for me is a dangerous statement to make to somebody who's suffering from mental health disorder, right? So let's go through and take a few questions. Hopefully from a few of you that we can kind of discuss not only maybe how alcohol has affected our lives, not us specifically, but even in our family members or friends, and also maybe questions on how we can help others. So does anybody have a question for me? Yes, sir?
Unless I missed it. You never mentioned genetic component. Is there one?
Absolutely. For many, many years, the studies showed that we thought it was about 30% hereditary. I'm seeing recent studies over the last 5 years that show maybe it might be as much as 60% hereditary. So now this is a great question. We're having the conversation between nature versus nurture, right? And it's usually a compounding effect or a little bit of both. So we know we can take NICU babies, babies that are born with drugs in their system or alcohol in their system, and that baby can be removed from that setting, put immediately, as soon as possible, into foster care, and that child will still have a 30 to 60% higher likelihood of developing a substance use disorder as an adult. Depending on which study you read. So that's the nature, but we also have the nurture topic, which is a lot of times children that grow up in homes of parents who are alcoholics grow up in homes of dysfunction. I don't like the word toxic. I think that's a terrible word. I think we need to get it out of our lexicon here in America. Right? Not everyone's toxic, but we do live with dysfunction. Right? And if I have an alcoholic or a drug addict parent, if I have a parent who's suffering from an alcohol use disorder or a substance use disorder, or I have a parent who's a problem drinker, right? I'm probably witnessing a parent who's in dysfunction. And again, if it is, and it is a mental health disorder, this is a person who's struggling with their mental health. So it's difficult to love properly and to be available, right, and emotionally to support others. And of course, if I were to take another road to that through Alcoholics Anonymous, I've learned that selfishness and self-centeredness is usually at the root of someone's addiction. Right? Where it is a coping mechanism. We're trying to balance or get right. We're trying to fight whatever this inner monologue is in our head. So great question. It's probably some type of hybrid that's going to happen in most people's lives, but absolutely. I myself, I'm a recovering alcoholic and drug addict, and I grew up in a home without substances or alcohol. I grew up in a home where my parents did not drink. I grew up in a family. I'm one of 4 siblings. I'm the only one with a substance use disorder. But at the same time, I'm younger by 10 years than the rest of my siblings, and I experienced a lot of dysfunction in the home during a death of a parent and a bunch of other stuff that happened. So to say we grew up in the same setting wouldn't be true. Right, so good question. What's another good question we can have about alcohol use disorder? Caroline.
What would you say to somebody who's watching this or listening to this and is like, ooh, maybe I need to do something here? Interpersonal, right? So if it is me, good question. So if we are watching this or we're listening today and we say, this might be an issue in my life, the first point I would make is if we're having that internal dialogue with ourselves that is this a problem, it probably is. right? So once that internal awareness comes available, which is we're usually the last ones to see it, right? There's an old saying in self-help and personal development which goes like this: it's really hard to read the label from inside the jar. Right? So a lot of times it's hard for a lot of us to self-diagnose. So if somebody is asking themselves that question, hey, is this creating a problem in my life? We're probably at some jumping off point or turning point where we're going to want to maybe take initiative and get proactive instead of reactive. And again, in the beginning, like we talked, this could be a conversation about, pre-addiction. Right, where maybe I'm experiencing a couple social issues, right? I'm not quite as available as I used to be. I'm not as reliable, right? I'm isolating a little bit. One thing we're sure of today, and we've been sure of this for about 85 years since the Alcoholics Anonymous book was written, is that active addiction is isolation. So if that's true, then the inverse, active recovery, would be connection. Right? And there's a lot of profound TED Talks right now where people are like, man, guess what we figured out? But if you read the Alcoholics Anonymous book from 85 years ago, they already kind of figured that out a long time ago. So, but a great question. If I'm experiencing some turmoil, and again, this is why I love the term problem drinking. Hey, maybe we're not full-blown in substance use disorder where I need to be de-escalated medically at a hospital, but I might be not committing to my social responsibilities or my interpersonal or family responsibilities as well. So good question. I would say the next step too would be then to request the help of a professional. So a place like Glenbeigh, right? I do this a lot with even with our new hires. If we really want to help somebody, here's the best thing you can do for them. 440-563-3400, ask for admissions. 440-563-3400, ask for admissions. And what will happen was they'll get put on the phone with a qualified professional that we can then figure out what avenue would be best. Right? Because it's not always in hospital treatment. Maybe it is just coming in, talking to somebody. Let's do an assessment, right? Let's take a look at a couple things. Let's have a professional, someone who's educated in this, take a look, because it might be mild. It might not be severe, right? It might be the early onset of something that I want to get taken care of. We would do this with diabetes, heart disease, weight gain, right? Obesity in our country. We would be proactive on all of those topics. And again, instead of saying this is a moral failing because I drink too much, we want to look at it as I'm obviously compensating, I'm medicating for something, right? And again, this is why, and I love to have this conversation. I love the larger word addiction, because I can be addicted to anger and judgment and resentment or fear or anxiety, or I can be addicted to worry. I can be addicted to my Doritos. I can be addicted to comfort food, right? I can be addicted to cigarettes, energy drinks, right? Again, my phone. Take someone's phone from them and watch them panic. Right? It should be a very big warning sign. So I think if we look at it from, instead of this 2-inch view of alcohol use disorder or problem drinking, and if we look at it from a 200-foot view, I think we're a little safer that way. So again, instead of it being so personal, when you do, you make me feel, right? Instead of it having that conversation, we can say, hey, are you okay? I am concerned, right? I see a little bit of a lessening of you, who you are and your personality. Who's got another question? And I just broke that. I'm sorry. All right. Yeah, go ahead.
This is kind of off the track because it doesn't have to do with alcohol per se, but cannabis is becoming legal.
Yeah, good question.
And there is medical use presently. I have a family member who is abusing it, even though he has his medical card. He's my child, actually, so it's very painful to watch.
Sure.
But it's acceptable, and it's like the new alcohol, because
Absolutely.
alcohol doesn't affect everyone the same way. But there, of course, are people who do abuse it.
Sure.
Where do I go with that? I know Al-Anon would probably help,
Sure.
but
I would do Al-Anon, and also I would, this is a great question, right? So to restate the question so we can hear it on the video as well, I have a family member, someone I love, who's got a medical marijuana card, who we're concerned, right, that they might be abusing that privilege just like we would any other medication, right? I get a tooth pulled and I get an opiate, right? Whatever that might be. I'm having a stressful time in my life. We have to decelerate some of my anxiety for a little bit. So maybe I've been prescribed a benzodiazepine, a Valium, or a Xanax, and now I'm abusing that too, right? I'm taking that, I don't like the word abuse. I'm using it outside of the parameters for how it was prescribed. Let's say it that way, right? So great question. I would treat this as I would every other form of substance use disorder on the planet. We know for sure that marijuana is just as addictive as any other substance. We know that we can go through a detoxification from marijuana, right? Same, and it's all the same on the statistics manual too. It's all of the same: failure to meet responsibilities, raising of tolerance. Right, so no matter what we're doing, if it's we're having a few drinks a night, or we have a medical marijuana card, once we need more and more and more and more to achieve the same result, this is an issue, right? Now we're building a tolerance or resistance, and that's part of the diagnostic manual that we would use at a place like Glenbeigh to decide whether or not we have an issue, right? So, or a concern. So great question. Now, how do we react as the family member? I think you're right. Al-Anon. Al-Anon's one of these, we hear this word and we almost disregard it because of like maybe what our societal or mental image is of what Al-Anon is. So let me use a different term: support group. This is much more important to use that term. So I think, Mom, you need a support group. We need to be around other people who know what it's like to love somebody, where we're watching this happen, right? Again, if you and I were combat vet survivors and we know what it's like to shoot people and be shot at ourselves, we probably need to meet with other combat vets that understand what that experience is like, so we don't feel like we're crazy. Right? If I'm a stage 4 lymphoma survivor and I know what it's like to sit in those gigantic blue chairs and have all of that stuff hooked to me, and day after day not see Fred come in and not see Julie come in and notice that Amanda's gone now, right? And to have that experience and to walk out of there and be the one to live, I probably need to be around other people that have had that experience, right? My beautiful wife is a domestic violence survivor, and even though we work a 12-step program, she still needs to meet with other people that understand what it's like to love somebody that abuses you, because I don't know what that experience is like, and she can't receive that help from me, right? So the same with us if we're suffering at home where we love somebody who might be misusing a substance, right? We need to be around other people that know what that's like, because you are stuck a little bit, right? We want to offer support, like we said. We want it to be compassionate. Right? But sometimes it's hard. A lot of times those of us that are in active addiction are the last ones to see the issue. So I think we approach with an I statement. I'm concerned, right? I'm worried that we're seeing some differences in your personality, right? I'm sure there's probably a lowering of adversity tolerance, which is usually a real quick sign that we're having an issue with substance use. A heightening of stress, anxiety, that kind of stuff. So, good question. Support group for sure, and I would treat it like I would any other substance. Because you're right, this is the hot ticket item right now socially, is marijuana. And hey, right, nobody passes out. Well, you could actually, but right, we don't have hangovers from it, even though we see a lot of studies that say yes, you do. I know one drink of alcohol, and they're trying to do the math on marijuana, which the trouble is, there's such a variety. But smoking marijuana or one drink of alcohol can lower our reflexes by like 30%. Right? So this is the issue of getting behind the wheel, that kind of stuff. So good question. I say we fall right back into any other category with substance use, because that's exactly what it is. Who's got another question for me?
Thank you.
Appreciate you, absolutely. Yes, sir.
You're talking about whether it's marijuana or alcohol culturally, it's accepted, it's promoted, whatever. What does Glenbeigh advise as far as someone who may have use disorder to avoid it?
To avoid.
Either being in the places with alcohol. What are some suggestions that you would have for people that?
So if I'm recovering right now, is that what we're saying? Okay. So what we're talking about is there's an old saying: go to a barber shop long enough and you'll get a haircut. right? So I'm using all kinds of old school AA terms now. So that's exactly the idea, and I appreciate this question. That's a good idea, or a good question. So eventually, the goal would be to be a recovering person where we don't have to hide or run from those things. But in the beginning, right, I know, let's put it in a different term. Let's put it into health and nutrition, diet and exercise, which is really the most common parallel to addiction. Is, I can be diagnosed with early onset of diabetes or heart disease and still not change my diet, not exercise regularly, right? But I'm hoping the medication will help. And we see almost the same response with substance use disorders as well. So the idea in the beginning, yes, we got to be cautious. We got to be careful what we're around. Temptation's real. Triggers and cravings are real. But the goal would be to recover in such a way where I don't have to worry about the birthday party or the wedding or the funeral or to go out socially and enjoy dinner. But probably in the beginning, and that, this is another general term, the beginning. That could be months for some people or years for others, depending on how proactive they are in their program. But I think as a family or as a friend or as a coworker, we should be very aware of that, to ask that question, is this comfortable for you? Right? Would you prefer something else? Not, again, we got to be careful. We got to be compassionate. We can't say, hey, is this going to make you want to drink? Right? So now all of a sudden we are kind of pushing something up on somebody. But if we can kind of reword that or rephrase it in a compassionate I statement, right? I'm worried that this might not be the best setting for us. Is there somewhere else you'd prefer to go? Right? That's a great way to do it. But I know to this day, if I have to go to a niece's 8-year-old birthday party, there's probably going to be alcohol there. Right, so the goal is to build a lifestyle and a program where I can be around those things. And again, not have to run from it or create a phantom-y figure out of it, right? This phantom-y figure in the night that's going to come get me, this alcohol or this drug, and actually realize that the issue is within me, right? It's the way I handle my emotional turmoil, my decision-making, and also how proactive I am on my program, right? Because really, if we took substance use disorder or let's take diabetes, right? If I have diabetes, I can go to a doctor and they would say, hey, take this medicine regularly, exercise 2 or 3 days a week, and watch what you put in your body, and you can probably live a great life. And I would argue I contend that the conversation is the same for substance use disorder. Take this medication a little, regularly. Let's get things leveled out. The chemistry set that is our brain probably isn't functioning really well right now, right? We've been adding a substance, so let's have this to reduce harm and get leveled out, right? Let's 2 or 3 meetings a week, or group therapy, or some type of talk therapy session, right? And watch what you put in your body, and you can live a great life. So the conversations are so close and so parallel. Great question. Any other questions? Carol Ann, one more before we go. Dr. Szymanczyk?
Put me on the spot.
No, okay. So let me turn a corner then and kind of sum up or wrap up for us. As we talked in the beginning, let's get away from some of the stigma of alcoholic. Now, if myself, as a recovering person, if I choose to use that term in some way to keep the relevancy for me, that's my decision. But as far as an outside person looking in, we want to get away from the word alcoholic, drug addict, right? This is a substance use survivor, right? That would be a great way to put it. But I think for April being Alcohol Awareness Month, and for the larger conversation that we're trying to have today, problem drinking. Problem drinking, right? Is this benefiting you anymore? Right? Is it really serving a purpose that maybe I need to take a look at, right? Is it, I had a long day. I deserve this, right? Funerals are tough. I deserve this. It's a celebration. I deserve this, right? I need it to, tough, I'm stressed out. It'll take the edge off so I can go to sleep, right? So once we're using it as a salve, right, or some type of method of medicating, we should be concerned. I would put that in the category of problem, right? So let's keep that idea close to us, that the problem drinking idea, and also what we talked about with the pre-addiction, right? I think there's a lot to be learned from what we did with diabetes over the last 30, 40 years. And I think we're going to see that follow in substance use disorder as well, which is this pre-addiction. Am I in a dangerous area, right? So can I be proactive instead of reactive? And lastly, if we do have someone we love or respect or we're close to or we think a lot of and we want to have that conversation, I statements, it's so difficult to do. And I know in the heat of battle, right, in the moment, right, I have a home, I'm happily married, but I get it. When tensions are high, I forget all of that clinical training and I go right back to you did this and you did that, right? So, but if we can be purposeful, remember we talked about picking the time. Let's be really purposeful about it. I was instructed through therapy to keep a list together. So if we do, let's say in the moment we are upset, put that down in your notepad in your phone, and then have that time on Saturday morning where we can have that open forum conversation. Say, hey, I want to talk. Can we talk on Saturday over coffee? Public place would be a good idea. All right, let's go down to the coffee shop. And there's some things I thought we could talk about. So then it puts a little distance between the situation and my emotional reaction and the delivery and the conversation that I want to have with a loved one, right? Where I want to make an impact and I want to hopefully produce some type of change. So this is a difficult conversation. Alcohol, substance use disorder, let's just put it that way, affects everybody in today's world. Right, it's less of a socioeconomic issue than it's ever been. It's in every home. Everyone knows a neighbor that's been affected by it or a direct family member themselves. So again, let's not assume that we know because I am not an alcoholic or a drug addict or suffer from a substance abuse disorder or use disorder that I just have the answer. I can't coach someone anymore. Not being a diabetic, I can't give you real advice on how to eat for diabetes any better than if I'm not a person who suffers from an alcohol use disorder to give advice on that. So let's be really careful on that advice giving, but we can voice those concerns. So let's do it out of love and compassion, right? And also my last thing I'll say, if grandma is a diabetic and grandma eats too much cake at the birthday party, we don't yell and chastise grandma in public for that. Or hopefully you don't. If you do, you should call me, we should talk, right? But we don't do that, right? And I would encourage you to have the same attitude about this other health disorder, substance use, right? So if someone does slip, right, we can't see it as a moral failing, right? We can't see this as you made a terrible choice or decision. We need to look at it as a mental health disorder, right? Any big change in any adult's life is difficult. I don't care who you are. Come to me. You can call Glenbeigh, you can get my number, come to me and let's talk about cutting sugar for a week in your life and let's see how good you do with it. Right? And that's sugar. Imagine, right, if I do drink alcohol 2 drinks a day and I have been for the last 5 years of my life. Right? Reducing that's going to be difficult. Right? Any type of habitual action that we do is going to be difficult. So let's be considerate. Let's give people some room to move. Let's not chastise them publicly for a mental health failing or disorder. And you know what? Let's step to people with love and we might have a chance, okay? So I appreciate all of you for listening. Thank you, everybody. If anyone needs anything, one last time, 440-563-3400. Ask for admissions and we'll qualify you or your family member on the phone and get you with the right person for the right help.